My name is Kevin Dempsey and I represent Emphasis. We're a Boston, US-based technology development company. We're part of the Tecan group, who are a Swiss multinational. And today, before we do the important business of introducing you to some great new innovators, I want to talk to you about your choices when it comes to system design. So typically, when you're doing a design of a medical device, they're highly complex, involving many subsystems, electrical, mechanical, software, etc. So you have a choice. You can do a holistic, full system design approach, or you can take subsystem by subsystem approach. So there are some drawbacks of a subsystem by subsystem approach. You know, the main ones are when you go to finally integrate the subsystems, you can have some inconsistencies. They could be mechanical, electrical, or software. Siloed development generally leads to missed opportunities. And if you design the subsystems independently from each other, you might miss some growth opportunities or future product platform opportunities coming up. So we very much, to mitigate these risks, we recommend that you take a system-level approach, because we believe in our experience that the advantage of that is that you have a more integrated, efficient, reliable, and innovative medical device. So the holistic integration and optimization, a very practical example of why that's a benefit is, think about building a house. You're not going to build the foundation, walls, and roof and then come back and try to do the electrics and the plumbing. You're going to add cost because you're going to have to route out all of the channels for those. You're going to be suboptimal. You're going to have to put plumbing where it wasn't supposed to be. You're going to have to run a lot of cables to get around obstacles in the design, and ultimately you mightn't be able to give the experience that the homeowner wants, because you'll have suboptimal subsystems, which leads to a suboptimal full system. Similarly, when you have the medical in a medical device, when you have the electrical, mechanical, and software all working together, you get these synergies coming, and the groups work together. That can give you opportunities, and it can identify risks down the road. So it's very much a favored approach. The big one with the subsystem design approach is risk mitigation. So in our experience, we can do full system design, or we can do subsystem design for embedded systems, particularly around electronics for energy devices. But what we find when we go to do integration later on is that a lot of reliability issues can come up in the field, because when you take a subsystem approach, you do a ton of testing on that subsystem in a very controlled environment. But then when you go to integrate that device and then put it out into the field where it's used by many different users with many different use cases and different environments, a lot of reliability issues can pop up that would have been spotted a lot earlier if each of the subsystems were designed together. And I think it's no surprise to anyone in the room here that having a single medical product is difficult. Having a platform is better. And you might have a single medical device idea, but when the various functions get together, the mechanical engineers might say, hey, in the future, we'd like to do a few different versions of this handpiece that will give a more comprehensive solution to the clinician. And the electronic and software engineers can say, well, why don't we pre-position for that now? By putting in, say, more software computing power, we might be able to add some video imaging later on in later generation products. Or by putting in, the electrical guys might be able to put in variable power and frequency to offer a whole suite or a suite of products. And again, no surprise to the industry leaders in this room that having a team that are communicating effectively every day, multifunctional team communicating effectively every day, is going to be better than having sub-teams off working on their own and communicating maybe at best once a week. So in conclusion, I know it's not always possible, but where possible, try and bring in all the functions as early in your product design as possible. You'll have a much better design. And just the last 40 seconds on what we do. So we do technology development as a service, Boston-based, as I mentioned. We're fundamental science and engineering, so we have industry-leading COMSOL multi-physics simulation and labs where we can iterate physical hardware, test it back to the models, and we can get you working prototypes for energy-based medical device in a matter of months, not years.